all the way across. Hey everyone, and welcome to Chef AJ and Friends. Today's the second Wednesday of the month, which means it's time for Can Fasting Save Your Life with Dr. Alan Goldhamer, co-founder of the TrueNorth Health Center. And today he's going to discuss the 10 most important actions for achieving health. Please welcome him back to the show. How are you, Dr. Goldhamer?
I'm doing great, AJ.
Great. So 10 most important actions. Are there only 10?
Well, there's a lot of things that people are told to do, to buy, to sell, to eat, to not eat. So I thought it might be worthwhile reviewing what I think are 10 of the most important things that actually make a difference in helping people get and stay healthy.
That's great. Thank you. I look forward to your presentation.
So the first thing are avoiding chemicals and drugs. And drugs include a wide variety of chemicals now, including caffeine and alcohol, recreational drugs, over-the-counter drugs, prescription drugs, and chemicals that we can be commonly exposed to include pesticides and herbicides and volatile organic compounds and heavy metals. And there's also a variety of contaminants in both air and water, things like cosmetics, household items, fungus, molds, paint solvents. I mean, it's just, there's so many opportunities to get exposed to various chemicals. And we might ask, why on our 10 most important things to avoid are drugs and chemicals number one? And if you think back to our evolutionary history, you realize that these substances were dramatically less available throughout most of our history. And so there's never been much in the way of evolutionary pressure to develop resistance to these things. It's not like, oh, anybody that couldn't handle exposure to these chemicals died, and the people that were capable of handling it survived, and therefore you developed resistance over time. No, these are relatively recent introductions in our history. And as a consequence, you don't know what your individual tolerance or thresholds are going to be when it comes to response to these chemicals, which are going to cause heart disease or cancer, difficulty in you. So the best strategy has to be minimizing our exposure to chemicals and drugs in general, and hope that your other diet and lifestyle issues are sufficient to provide enough resilience that your inevitable exposure doesn't become a limiting factor. And in order to avoid drugs and chemical exposure, it's helpful to take a look at a human being and figure out, where did the chemicals that are inside the human being come from? If you take, for example, a human and do a fat biopsy, you'll find hundreds of different chemicals, PCB, dioxin, pesticide residues, etc., in that tissue. And some people, obviously, they get exposed, they breathe air that's polluted, they drink water that's polluted, hasn't been filtered. But as much as 90% of the average load of the average person got there by eating animal products, because animal products biologically concentrate the materials from the animal's environment, as well as their feed and chemicals and drugs that are given, etc., such that by the time you look at a calorie of, say, plant foods versus a calorie of animal foods, the animal foods could have 2 to 1,000 times the concentration of pollution compared to plant foods, which gets us to the number 2 thing on our list, is adopt a vegan diet. So a vegan diet is free of meat, fish, fowl, eggs, and dairy products, which are the biologically concentrated sources of these toxins from number 1, as well as excess fat and protein that leads to increased risk for cardiovascular disease and cancer, etc. And the number 3 thing on our list is avoiding chemicals added to food. And the food chemicals that we add include salt, oil, and sugar. And salt, oil, and sugar are interesting chemicals, although they are nutrients. The amount that you need is contained in whole plant foods. Whereas when you concentrate and isolate them, they end up having a drug-like effect. And that's why we talk about the dietary pleasure trap, that people can become addicted to the artificial stimulation of dopamine in their brain that comes from adding these foods to these chemicals to their food. And when they do, they can fool the natural satiety mechanisms in the brain and lead to overeating, which is why people get fat and why about 10% on average of their fat is visceral fat. And the visceral fat tends to be pro-inflammatory and acts like a tumor. And so if you have a lot of visceral fat, your increased risk for heart disease and cancer and diabetes, et cetera, is increased. And a major part of how it is we get and stay fat is by fooling our normal satiation mechanisms in the brain that keep us from overeating. And we fool it with these chemicals, the salt, the oil, and the sugar. So we want to avoid that. Number 4 is we want to engage in exercise. Now, in a natural setting, this wouldn't have been a problem because people had to move around to get enough to eat and not get eaten. They got hot, they got cold, they got hungry, they got thirsty, or they didn't want to get eaten. And so activity and movement was an essential part of survival. Today, we've gotten to the point where people can sit around and not be very active and still get enough to eat. In fact, a lot of men in our society have taken to hiring other people to exercise for them. It's called the NFL. And so people sit around in overstuffed chairs, drinking high caloric beverages, usually brought to them by their spouse. And they pretend to be part of the winning coalition as they engage in mock warfare, rather than actually getting out and doing what we need to do, which is building strength, stamina, flexibility, and balance through walking, hiking, biking, swimming, and other activities. Exercise also has a profound effect biochemically on the body. It dissipates some of the consequences of stress. It increases chemicals like BDNF, or brain-derived neurotrophic factor, which is the chemical that prevents your brain from getting oxidative damage and ending up with Alzheimer's disease, et cetera. So, for example, if you have genetically bred rats and you compare them, they're fed exactly the same, they're kept in the same cages, but half of them are given a wheel that they can exercise on. The rats with the wheel will not get Alzheimer's disease. And they realize this because the exercise increases BDNF, or brain-derived neurotrophic factor, protects the brain. Presumably, this works in people as well. The other thing that increases BDNF, interesting enough, is fasting. And if you take rodents and you periodically fast them, you can actually double their lifespan. It's kind of fascinating. So anyway, number 4 on our list is exercise. And again, you want a variety of exercise that builds strength, stamina, flexibility, and balance. It's true what they say, if you don't use it, you lose it. And that's certainly a problem for people as they age. Number 5 on our list of most important things is sleep. Sleep is one of our most important activities. During the non-REM deep sleep, the anabolic cascade of hormones kicks in. It's an incredibly important part of healing. If you don't sleep enough, you won't heal enough. And getting enough sleep is also, in my opinion, critically necessary for maintaining optimum weight. When people don't get enough sleep, they're fatigued, they don't feel like exercising, they eat for stimulation to try to feel better, and their immune system doesn't work as well. So I think it's very important. If you want to lose weight and keep it off, stay healthy, you want to get enough sleep, and you certainly want to eat enough, particularly low density, high nutrition foods. So good sleep means 7 to 9 hours of high quality sleep. It means waking spontaneously, feeling refreshed. Best is done in a cool, dark, and quiet place, and it will help you overcome fatigue. It does stimulate healing, one of your most important activities. And one of the things you can do to help sleep is don't eat 3 to 4 hours before you go to sleep. You'll sleep better. And also, it'll give you a 12 to 16-hour period of fasting every day, which may be helpful at maintaining long-term health as well. Number 6 on our list is fresh air and sunshine. Of course, our ancient ancestors never had to worry about that because that's the only kind of air there was fresh air. And you had to get sunshine just by being out in the environment, trying to get enough to eat and avoid being eaten. But today, again, we can sit behind plate glass windows and avoid exposure to adequate sunshine so we can develop D deficiency, which causes osteoporosis and increased our risk for cancer and chronic pain and other problems. So get outside, get sunshine and fresh air. Number 7 on our list are developing effective social skills. So it turns out we're kind of like not, at least most of us are not social isolates. We're pack animals. And we're designed to evolve in probably small packs of 50 to 200 people. So going along and getting along became a very important issue. And if you don't have the skills to get along and go along, you certainly will pay a price psychologically. This also involves avoiding negative influences in your environment, including what I call energy vampires. And those are people that do what they do best, and that's make other people as sick and miserable as they are. So by comparison, they don't have to feel so bad. And these are the people that will constantly try to bring you down, undermine your success, and give you a problem when you engage in health promoting behaviors. So you got to try to figure out how to kick them to the curb, avoid them, or manipulate them, however is necessary. Number 8 on our list is nutritional excellence. You get the quantity and quality of nutrients you need on a whole plant food SOS-free diet without the dietary excess. One exception is vitamin B12. Because B12 is only found from bacteria, in a natural setting, you get tons of bacteria exposure. You wouldn't have to worry about it. But in the modern world, because we wash and peel and we're really careful to avoid worms and parasites and other problems, which is good, we don't get much bacterial exposure. Meat eaters certainly do. They get all that fecal contamination of their dead, decaying flesh. But as plant eaters, we don't get a lot of exposure, and eventually you can develop B12 deficiency, which leads to megaloblastic anemia, neuropathy, and other problems. So take a supplement of B12, 1,000 micrograms of methylcobalamin a day. We use the brand Pure Encapsulations. They make a vegan capsule. They also make a liquid, which I like, costs less per dose. And that's simple enough. If you don't get out in the sun or you live too far north, you might have to supplement D. There are other nutrients that occasionally people have issues with. Iodine, for example, if you live in Minnesota and didn't eat any food grown anywhere else, you might develop iodine deficiency. And DHA, for people that can't include nuts and seeds in their diet, sometimes they have to resort to supplementing DHA. But in general, the only nutrient that's routinely involved is vitamin B12 for vegans. And number 9 is fast when appropriate. Now, we suggest that everybody fast every day for between 12 and 16 hours. And you do that by not eating 3 to 4 hours before you go to bed at night. And if you're trying to lose weight, you might even delay breakfast till you have a chance to do some exercise. In the morning, preferentially burn some fat. But fasting for a longer period of time, if it's appropriate, can also be a benefit, whether you're sick, trying to get well, or we also believe healthy people that fast once a year for a week or so may get additional cumulative benefit. So it provides rest, rejuvenation, detoxification. It helps you reboot your gut microbiome. It helps neuroadapt your taste. One way that you know you need to fast is when good foods don't taste good. When good food don't taste good, it's a sign you're caught in the dietary pleasure trap, and you might need recalibration. If you need to do that, come to the TrueNorth Health Center, or work with a local doctor and one of our doctors through our telemedicine practice. So you want to ensure that you rest when you fast, that you're a good candidate for fasting, and that you recover properly to avoid post-fasting refeeding syndrome or complications. Number 10 on our list of most important things is education and inspiration. And I didn't really appreciate this, how important this was early in my career, but it turns out you live in a world designed to make you fat, sick, and miserable and give you what you want, but not what you need. And so even when you're healthy and even when you understand this, it still helps to read books, go to seminars, engage in support groups, find help and support from friends that are health conscious. Do what you have to do in order to be able to maintain health and happiness, because it does require ongoing education and inspiration to overcome all the factors of the channel factors, all the factors of the pleasure trap. And, it's a huge challenge. It's probably one of the more difficult things people will ever do. If you haven't read our book, The Pleasure Trap, it'll explain how and why you need to do what you need to do to get healthy. There's a lot of good cookbooks out there that are vegan, SOS free. And our most recent book, Can Fasting Save Your Life, I think is really a useful book that explains how fasting can be used effectively. So I hope that that's a nice brief review of the 10 most important things you're going to do to be healthy. And now what I'd like to do, and any time we have left, is try to answer your question.
Thank you. Would you like to stop sharing your slides for a moment?
Yeah.
Or I could do that for you. There you go. Well, if you guys aren't familiar with Dr. Alan Goldhamer, he is the co-author of The Pleasure Trap. He is the co-author of Can Fasting Save Your Life and the co-founder of the TrueNorth Health Center. It's been there for over 40 years now. Is that correct?
Yeah, we're starting our 40 in November. It'll be the end of 40 years.
Wow, that is
So we'll be starting year 41 here pretty soon.
So in some ways, this has been like your only job.
Well, yeah, it's really been my only job, AJ, because I got started with Dr. Lisle. We were talking about this stuff in seventh grade, so we were pretty young and got out of school and went to, chiropractic college and then osteopathic college. And then we started, as soon as I came back from Australia, we started True North and have done that continuously since then. Dr. Lisle says that it's a good thing that I work for myself because when he gave me a personality profile, I turned out to be 0 percentile agreeableness.
Oh,
So apparently I'm not that good a person at, you know, going along and getting along,
I don't know.
apparently.
I think you're very easy to get along with.
Hmm.
Anyway, but you did have one job though, didn't you, when you were putting yourself through school? I heard from Doug Evans you used to sell sprouts.
Yeah, I had a business though. That's a little bit different than a job because I didn't have to play nice. But yeah, actually, Dr. Lisle and I were involved with that together. We grew sprouts, so alfalfa sprouts, clover sprouts, mung, lentil, azuki, pea, all kinds of different sprouts. We did it commercially, and we had 100 restaurant accounts and United Groceries, and we had a big business, and we hired chiropractic and naturopathic students to help us. And we grew, a couple thousand pounds of these sprouts a day in a warehouse that we designed. And ultimately, when we sold that business, that money was used to fund the TrueNorth Health Center. That was the original seed money that we used to purchase, get the business going. So that was, it also put me through chiropractic college. So that was good too.
That's interesting. The selling of seeds was your seed money.
Yeah, that was the seed money. We figured out that sprouts, there was a problem with commercial growing sprouts. You used to have a lot of rhizobius mold that took the sprout crops out. And we figured out in my biology class that those molds don't sporulate under a certain temperature. And so we designed a warehouse to grow these sprouts using grow lights and everything, but that kept the temperature below the sporulation rate. So we eliminated spoilage. And so then we were able to not only grow our product, but we could also sell product to the other companies. And eventually, when the other companies delivered our product, the customers saw that it was a lot better and they all came to us. So we ended up taking over the whole Portland metropolitan market. And so it turned into a good business.
That's fantastic. Want to answer some questions from the live viewers?
Sure.
We have live viewers on Facebook, YouTube, and Instagram, so please post your questions in the chat. The first one is from Facebook. Marianne says, I remember hearing Dr. Goldhamer saying MS is not reversible. What is his thoughts on MS?
Well, multiple sclerosis is a progressive neurological condition that involves the demyelination of the fatty material around your nerves. So what we do know is that you can slow down the rate of progression of multiple sclerosis. Dr. Swank has published a number of articles and did some great research over a 50-year career showing that the patients with MS that ate a health promoting diet did much better than people that ate a conventional greasy, fatty, slimy processed food diet. So we know that there's evidence there. In my own experience, I've seen many patients that go through fasting and dietary change that do very well. Oftentimes, it seems to slow or freeze the progression of the condition. But I don't think there's anything that cures MS, anything any more than there's something that cures obesity or high blood pressure or diabetes or lymphoma or autoimmune disease. You're not curing these conditions, you're managing them. And so with obesity, if you go back to eating the processed foods, you're going to get fat again. You're not cured, you're just managed, and you're managed with a healthy diet and lifestyle, sleep, and exercise. Doesn't mean you can't keep your weight off for the rest of your life, but you're not cured. And the same thing's true with high blood pressure. You may normalize pressure, get off meds, and stay that way as long as you stick to the diet and lifestyle changes. But if you go back to doing the things that cause it, it's coming back. And the same thing's true with MS. Even if you go through a remissive phase, which does happen in MS, and you stabilize, that doesn't mean you're cured. You're just managed. And so the management strategy in MS is, a healthy diet and lifestyle.
Perfect. Thank you. A viewer on Instagram named Finnish Bird is asking, I've heard that fasting is not good for menopausal women as it will spike stress hormones. Is that true?
Well, yes, there's some stress hormones that'll spike, but it's not at all true that it's not good for menopausal women. In fact, it's pre and postmenopausal women do exceptionally well with fasting. During fasting, of course, part of the way the body heals is through inflammatory processes, and those processes are accentuated during fasting. And it results in what we call the healing crisis. But it's how chronic problems become acute and get resolved. So there's many problems that women have, including dysmenorrhea, menorrhagia, fibrocystic breast disease, uterine fibroid tumors, polycystic ovarian disease, etc., that respond exceptionally well to fasting and diet and lifestyle change. So the fact that stress hormones may go up during fasting doesn't necessarily mean that that's not an important part of how the body recovers. And so, in my experience over the last 40 years, dealing with 25,000 patients, at least I would say 60% or more are women, and a significant percentage of those are pre and postmenopausal. I would say that they get fabulous, consistent, and significant benefit from this type of an approach.
Thank you. You know, when you were giving your wonderful presentations of the 10 most important habits to achieve health, you talked about how certain foods fool the brain's satiety mechanisms. And I've heard you say that for the last 15 years, but I still don't understand that concept because I thought, isn't satiety something we experience with the stretch receptors in the stomach? What part does the brain play
Well,
in
there's
this?
a lot of satiety mechanisms. The stretch receptors in the stomach are one of the things that stimulate neurochemical um, satiation mechanisms. There's also caloric density issues, fat density issues where people eat the actual chemical composition of the food stimulates satiety mechanisms. So there's a lot of different mechanisms going on how the brain knows how much to eat, how to get enough and not get too much. And if you look, those mechanisms in people and animals work impeccably well. You don't see any obese creatures in nature eating a healthy diet. It's only when they get exposed to highly processed pleasure trap chemicals that they get obese. Look to your pets as an example. You feed them the food we feed people, they get fat just like we do, and then they get the same diseases we do. So it's not just the stretch receptors. That's just one of the many receptors, and one of those that's most effective when we include large amounts of vegetable cellulose in the diet, like salad and steamed vegetables, because those receptors activate, and then we become satiated. So it's stimulating various chemical responses.
Great. Well, we have a similar question that was sent in by Kath about how she's heard you often say that women are designed to be fat conservation machines, finding it harder to lose weight due to her hormones. And let's see, um, this is a long thing. I started a healthy BMI. Yeah, so she's saying that she finds that she went on hormone replacement therapy earlier this year, and she finds that she has to be eating pretty strictly, pretty perfectly, and also strict with her exercise to really lose weight at this point.
Yeah, so there are people in our society that have more difficulty losing weight than others, and they're called women. So they're full of estrogen, which is a fat storage hormone, which makes storing fat more efficient. And women have to be, surviving women had to be more efficient at storing fat to survive a period of biological vulnerability called pregnancy. And so the fact is, women are designed to store a higher percent body fat than males are, for example. They need to have a higher percent body fat to be at optimum health. Um, and when you think about it, if a woman's percent body fat goes too low, her body adapts by stopping milk production, by stopping menstruation, or stopping ovulation, and ultimately menstruation. So, the body's adapting to the fact that without extra reserves and storage, you can't be successful doing one of the most important activities, which is passing on our genes to reproduction. So if you're a female, there's consequences. It means you have to work harder if your goal is to maintain optimum weight. If you're exposed to highly processed foods, if you eat a whole plant food SOS-free diet, you should be able to achieve and maintain optimum weight and health just fine. But if you're exposed to the dietary pleasure trap, you will have an even harder time than males do, who are full of testosterone and tend not to be quite as efficient as females are at storing fat. And if you're a healthy female with a good plumbing system, you'll be even more efficient. So if you're finding yourself getting fat easily, don't think of that as a bad thing. Think of that as biologically a good thing, but you're in a bad environment. So a person that gets fat easily living in a natural setting, they're called winners. They're the survivors. A person that can eat whatever they want and not gain any weight, that's not a good thing biologically speaking. But in the modern world, if you're a woman with healthy plumbing and good genes, you're kind of screwed because you're going to be vulnerable to the pleasure trap. And if you eat those highly processed foods, it's really hard to not gain excess weight. And if you're trying to lose weight, it's really hard to lose weight, especially if you're a healthy, good biologically well-equipped system. So you have to be really diligent. But what you said with a key thing was now you're finding as you're aging and maybe slowing down a little bit, you have to be strict with your diet and your sleep and exercise in order to maintain optimum weight. That doesn't mean you can't do it. It's just hard.
Yeah. Thank you. Well, we have a lot of questions about this today because Debbie is saying, do you have any thoughts on BHRT for postmenopausal women? The lack of sleep and osteoporosis are her main concerns.
What are we asking, AJ?
BHRT, it looks like BHRT. I'm thinking hormone replacement
Yeah,
therapy. I'm
so hormone replacement therapy. Okay.
not sure what the B
So
is.
I've got a few thoughts about hormone replacement therapy. They used to tell women, oh, they had to take these hormones in order to prevent heart disease or something. And, the fact is, it's all a crock of crap. What we want to do is try to get hormone balance normalized as much as possible. It's not always possible to do that through diet and lifestyle changes and fasting over the short run. And so when hormone replacement therapy is needed, there are some versions of it that are less biologically challenged than other. There's some natural hormone therapies that can be used short term, which can provide symptomatic relief without necessarily as many of the serious side effects. And also, in some cases, this is necessary because there's been surgical changes or there's been disease processes going on. So normal hormone function isn't necessary. So replacement therapy may be called for. But what I would suggest is it's nice to work with a doctor that understands this stuff that's not an idiot. And so we have doctors on our staff like Dr. Peter Sultana and Dr. Chilla Varas that do a lot of work with women that are having these challenges, figuring out if medical therapy is necessary, how to do it the least damaging way possible, or if it's possible to transition away from the need for these therapies, how to do that. And they do a lot of telemedicine work as well as work at the TrueNorth Health Center. So you can access them through our website, fill out the registration form so we can hook you up with one of them, and then you can get some information and feedback from doctors that are used to their patients getting well rather than having people sick for the rest of their life.
Thank you. Here's a question on Instagram from Finnish Bird. And the question is, are there any benefits to fasting with more than just water, like a fruit only day or a fruit or vegetable only day?
Right. So that's not actually fasting. So the question is there different ways of doing feeding on juices and broths and things? And there's lots of different suggestions out there. There's all kinds of people publishing all kinds of information on intermittent fasting and modified feeding. But my suggestion in general is this. Number one, most important thing is eat a whole plant food SOS-free diet every day. So you have your salad, your fruit, your steamed vegetables, and enough carbohydrates so you don't get too skinny every single day. And then every single day you do a fast, and it's going to be between 12 and 16 hours. You're going to not eat 3 to 4 hours before you go to bed. Every day, get the sleep that you need, and every day try to get appropriate activity, and every day try to minimize and manage your stress. If you do that, you're going to find you're going to win. That's who ends up being successful. Now, are there programs, tricks and trades, and things you can do? Yeah, there's all kinds of stuff that's out there. That's not necessarily my area of expertise. My expertise is really how to feed well every single day, and then how to not feed when fasting is appropriate. So I'll defer to the other people that have all the different modified programs in there. But ultimately, it's going to come down to eating a whole plant food SOS-free diet.
Thank you. All right. Here's a question. What about a pear-shaped guy who holds more fat on the lower half of his body? What's the appropriate fasting routine for such a person despite being an SOS-free vegan?
Right. So I'm a little bit suspicious that people are holding excess fat and not making slow progressive improvement if they're actually on a whole plant food SOS-free diet. If they are, and then my guess would be we have to continue to fine tune the dietary concentration of the diet. So it might mean we need more salad and more steamed vegetables and a little bit less of the more concentrated food. You may have just such an efficient system that you're able to absorb enough, even from the healthy, but still more concentrated foods, such that you're just not eating enough of the low density foods to reach satiety, and therefore you're still getting a little more caloric density than you probably need to. Sometimes people might need to, maybe they're using nuts and seeds in their diet and eating a little too much of them. Maybe we need to cut the concentration back there. Or maybe the level of exercise and sleep you're getting isn't actually ideal for you. Maybe you need a little bit more in the way of sleep and exercise in order to maintain optimum health and function. So I would look at fine tuning that. It wouldn't change the nature of the diet, and it certainly doesn't change how we do fasting, other than, if you have excess body fat stores, we'll fast until those excess stores are gone, ideally.
Yeah. Do you measure that at True North other than just with a regular scale?
Well, we did for our study. For 2 years, we had a DEXA scanner at TrueNorth Health, and we did detailed body composition. And what we found was that when you fast, the body preferentially mobilizes visceral fat. And we have a whole formula that we follow in terms of what happens. For example, a person in this study fasting 2 weeks might lose 10% of their total body weight, but 20% of their fat and 40% of their visceral fat and 6% of lean tissue. But by 6 weeks follow-up, AJ, all the lean tissue had recovered and then some. So I don't think it's necessary to do DEXA scanning and do percent body fat calculations in order to be able to guide people, because it's the same pattern all the time. Eat the whole plant food diet, you lose weight, you lose down to optimum weight, and your body balance corrects itself. But if you want to do it, there's certainly those devices available out there. One of the disadvantages to an accurate measurement is that it requires low-level radiation exposure. That's part of the DEXA scan. It's used generally to do osteoporosis screening, but there's special software that allows you to do whole body composition. But I think, what people need to know is just lose weight down to your optimum weight, and you can be pretty confident your body balance is going to be in line.
But is it important, though, for people to know? Because you talk a lot about how the visceral fat that surrounds the internal organs is much more dangerous than the subcutaneous fat.
It is. And so if you have belly fat, that's typically a higher percent visceral fat, but about 10% of the overall fat in general, on average, is going to be visceral fat.
Where does a regular person get this test if they're willing to pay for it? Like
they would go to any imaging center, that does where the same place where they would go to get their osteoporosis screening. It's the same machine. It's a DEXA scanner.
And so that's
your local radiology, your local physician who can refer you to that.
Would that be the gold standard?
Yeah, that would be the most accurate way of assessing not only total body fat, but differential visceral fat from body fat. But I have to say, AJ, there's a little bit of variance in the technique that's used. So you need the right equipment and you need the right examiner. We went to a lot of trouble to train our doctors to be able to collect this information accurately for the study purposes. But even there, there's a little bit of variance in there. So it's not quite as black and white as you always might assume.
How accurate remember those dunk tanks? They used to have them at your gym.
Yeah.
How
They're accurate for assessing fat, but they can't differentiate visceral fat from subcutaneous fat. And that's where the study it was important for the study for us to show this ability of the body to treat visceral fat like what it is, a tumor.
So the calipers, those don't differentiate visceral for subcutaneous either.
No, but just remember that visceral fat tends to accumulate around the organs and around the belly. So when you have a bunch of belly fat, you can be confident there's some excess visceral fat there.
Thank you. There's a question from Dixie. What do you think about grounding bed sheets? I've never heard of those.
Well, the idea is that, we're kind of electrical beings, and we insulate ourselves from the earth, and there's a theoretical grounding effect. And people do things like they'll walk barefoot on the grass or things, and they feel that has some beneficial effect. I haven't actually seen what I would consider substantive scientific data supporting that. But if you feel better getting barefoot, walking out in the grass or in the sand or something like that, I think that's perfectly fine. Just don't cut your feet.
Okay, thank you. Here's a question from a live viewer on YouTube. What do you recommend for a person who is 79 and carrying about 20 extra pounds and dealing with high blood pressure and hypertrophic cardiomyopathy on 6 medications for heart, blood pressure, and migraines?
Well, I'd say you're kind of our kind of patient because you're heavily motivated by pain, debility, or fear of death. So that makes you motivated. You have conditions, the chronic cephalgia, the high blood pressure, and the obesity that typically respond very predictably. I would say the first thing to do would be to complete the registration forms at TrueNorthHealth.com, and I'll offer you a no-cost phone conversation to review your history and figure out what direction to point you in. We'll get you hooked up with an appropriate doctor that'll help you reinforce the dietary changes so you can wean off the medications, then hopefully do a fast resolve your problem, and then get you to sustain those results hopefully over the long run. And that's really the only challenging part of this whole thing is you'll get healthy and you can make improvement, but staying healthy is a real challenge because people insist on living in the real world.
Oh, brother, how dare they,
I
right?
know it's so annoying. If we were like a regular research lab, AJ, the rodents stay in the cages. They live there the whole life. But our subjects insist on going back home and living in the real world. It's a big challenge.
That's the hard part, isn't it? Going
I
home.
know I suggested we just keep them there indefinitely, but people said it's not practical.
And it's probably not legal either, huh? Okay,
Mm,
great.
yeah, that too.
Oh, yes. Okay. Oh, here, I forgot a question that was sent in already in advance from Leah. She would like to know, can people with low blood pressure fast safely? Assuming no other health concerns, how long can a person with low blood pressure fast?
Well, first of all, a lot of people that think they have low blood pressure actually have what's called healthy blood pressure, like 90 over 60. So average healthy blood pressure would be probably 90 over 60. But if you go into a doctor today with 90 over 60, they may never have seen that before. It's just like if you go into a doctor and are a normal weight, they don't kind of know what that is. In fact, if you're a woman and you go to the average physician and you tell them, "Oh, I lost 25 pounds," they won't think, "Oh, did you join Chef AJ's group and adopt a whole plant food diet and begin exercising?" The differential diagnosis for women losing weight in our society today is they have cancer, or they have a drug addiction, or they have an eating disorder. For most physicians, the only people they ever see lose weight and keep it off are people that are dying of cancer or have drug addiction or eating disorder. So things are a little bit screwed up now. So that's the first question is what made you think you have low blood pressure? Just because it's not as high as everybody else's doesn't mean it's clinically low. If you're having dizziness on arising, or if you're having orthostatic hypotension or other problems, that's different. And that may or may not have anything to do directly with what your blood pressure levels. It may have to do with your autonomic nervous system or other issues. So we need to diagnose that and figure it out. But to answer your question, people that come in, say, with 90 over 60 blood pressure to start with, typically continue to have 90 over 60 blood pressure or slightly lower while they're fasting. So normal blood pressure tends to stay normal, but very high pressure tends to normalize. So that everybody ends up with normal pressure usually by the time we're done if we fast long enough.
Thank you. Look for the Veg asks, when someone has had a stroke, can they do fasting 1 year later?
Well, if a person is stabilized off their anticoagulant therapy, then the answer is yes. However, many people that have had strokes or pulmonary embolism or DVTs may be on anticoagulant therapy. That therapy, although it may reduce the risk of future stroke, is very dangerous to just arbitrarily discontinue. You don't just stop it suddenly because that can induce a stroke. Or a person that's had a stroke is likely to have another stroke, even with anticoagulant therapy over the short run. So the point is, yes, if a person's clinically stable and they're off their anticoagulant therapy appropriately, then they would be a potential candidate for fasting. But if they're on that therapy, we would probably keep them on that therapy, but do a modified program, 600 calories of vegetable juices, broth, etc., such that we didn't have to do rapid withdrawal of their anticoagulant therapy. Because then if they were to have a clot, it would definitely be attributed to either that drug modification or to the fasting, regardless of whether that's the reality or not.
Thank you. This question was sent in by Becky, and she said that she completed a fast at home for 5 days, medically supervised water only, then 3 days of veggie fruit. Oh, maybe that was the prep, following we're feeding guidelines for 2.5 days and following a McDougall diet for over 15 years. She had no medical issues nor weight issues, and she was not expecting to lose multiple pounds of muscle during the process. And she's questioning whether this loss of muscle, she's in her 50s, was worth the trade-off of any benefits she had from the fast. Can you please talk
Well,
about
first of all, she didn't lose any muscle cells. The cells might have gotten a little smaller, just like fat cells do. In our studies, at 6 weeks follow-up with appropriate refeeding, all of the lean tissue has recovered. The only thing that continues to come off is the fat. So if she's saying that she's lost muscle mass because she's weaker or something, that's one thing. We have to build up muscles. Obviously, there's a pathology of bed rest when you're resting. But if you're saying you've lost bulk lean tissue, that I'm wondering, if that's being interpreted accurately, because that's not been what our experience is. That people, yes, they lose muscle, fiber, glycogen, protein, and fat, and they regain protein, fiber, glycogen, but not fat.
Yeah, she was
The
asking,
fat loss continues.
wondering if you could talk about your experience with patients losing muscle mass and whether or not the muscle loss is permanent.
Yeah, so the muscle, they do lose about 6% of their lean mass in a 2-week fast, and they regain that 6% and then some. Understand, our patients at the end of 6-week follow-up, the percentage of their body that was made up of lean mass was actually higher than it was at baseline before fasting.
That's great. I saw a question over here. I'm jumping over around. Could you talk about the health benefits of beans and the after meal effect and their role in adding?
The after meal effect in terms of gas, is that what they're talking about?
The after meal effect of beans. I thought Dr. Furman said something like they're particularly good because they make you maybe feel fuller. I don't know.
Okay,
Oh, the
so
after meal
yes,
effect.
beans have a low glycemic index, so that in other words, you don't see your blood sugars jump up proportionally as much as you might with, say, grains or something like that. They're highly satiating because of the nature of the fiber. They're high protein, proportional foods that people, find are quite economic. So there's the people in the world that make less than $5 a day, the billions of people live on rice and beans because, these are the lowest cost per calorie, easiest to produce foods. And if you're able to digest beans and you don't overdo them, they're very rich, so you don't want to get too carried away. They can be an important part of a healthy, health promoting diet. They're certainly one of the staple foods, around the planet for human beings. To get better digestion of beans, there's things you can do in their preparation. You can soak them overnight. You can boil them, drain them, and then cook them slowly. You can even use your food processors like the Instapot to more efficiently process beans to make them more digestible. I think one of the keys with beans is, you find the beans you enjoy and that you digest well, and limit the quantities of them and mix them with lots of vegetables so that you're using them as a enhancing component rather than the base of the meal. And so I think beans certainly can be included in a healthy diet for most people. But if you don't digest beans, that's okay. Just don't eat them. You can eat more starchy vegetables and you'll still get everything you need.
You wouldn't believe how you get the way the plant-based community is I personally don't eat any beans or legumes. I'm actually have an allergy to them. And people think that if you don't eat beans or nuts, you're literally going to drop dead.
Well, you are going to drop dead. It's just a question of when, and there's no reason to think you're going to drop dead any sooner because you don't have beans or you don't have any other magic ingredient in the diet. Understand, there's whole cultures, AJ, that rely on different starches and different materials and don't use any other materials. And there's no magic food that everybody has to have in order to be healthy. The only exception to that, I would say, is most important food for humans is breast milk when they're babies. And so, not that people don't survive without breast milk too, but they survive better if they have an opportunity to be breastfed
Thanks.
as a child. So I think it is important that we try to breastfeed our babies. But beyond human breast milk, I think the other foods are all flexible and variable.
Thank you. I appreciate that perspective. Luann wants to know, how do you feel about blue-green algae as a replacement for DHA, and how you feel about chlorella and spirulina as
Yeah,
supplements?
well, all these pond scum products are basically scum that's grown naturally on the surface of polluted lakes. But I know they are cultivating some of this stuff now. And if you like sea algae or whatever, I mean, I don't know that it's the end of the world as long as it's not full of heavy metals and other contaminants that you'd find naturally. Um, and certainly small amounts of sea vegetables in the diet, like dulse and kelp, can be an important source of iodine and trace nutrients and things like that. And we do include small amounts of these materials in the diet. Not so much the pond scum stuff, but the actual sea lettuce and things like that. Um, Mostly, I think it's hype. People are, growing health food products and selling them at an inordinately high cost per pound, promising the magic of, highly concentrated superfoods. But I think the real superfoods are the foods we eat in the diet. So the fruits and vegetables and these products. And so if you make your diet based on these high nutrient density or high nutrient density, low caloric density foods, I think you're going to get the quantity and quality you need without the dietary excess. So I'm not an advocate or a proponent of the jars of, sea algae, but if you want to include some sea vegetables in the diet, that would be fine with me.
Thank you. There's a question. Do you have any experience with chronic myeloid leukemia? I've been off drugs for a year and a half doing whole food plant-based diet and MR1, but I want to achieve MR3 or MR4. Could some fasting help?
Well, that would certainly be something to give serious consideration to. If you fill out the registration forms, we can certainly review your medical history and give you some good advice. We haven't published, as far as I know, any papers except on lymphoma. And so lymphoma is the condition we have the most long-term follow-up.
Thank you. And here's a question about low sodium. Betsy wants to know, she has low sodium levels. The doctors are worried. Can she fast and go on a no salt diet? She's a bit scared.
Yeah, well, if she has low sodium levels, we need to know why those sodium levels are low. We're seeing much more of that now lately. I've seen a particular rash of people having trouble maintaining sodium who've been on these GLP inhibitors. They've been taking these drugs. These new drugs are interesting, AJ. People are eating an ultra-processed diet and getting fat, and they have trouble losing weight. And so the promise of these drugs is if you take the drugs, you'll get so sick that you won't feel as hungry for your ultra-processed foods. You keep eating your ultra-processed foods, but you won't eat as much of them. And it is true that over the short run, many of these people stop eating quite as much of the highly processed, ultra-processed food, and so they'll lose some weight. And being overweight is so dangerous that even poisoning yourself with a drug seems to have a net short-term benefit. The problem is long-term, of course, you get the gastric paresis and all. We're starting to see the lawsuits now. You see the TV. They're advertising for people that have been damaged by these drugs, and they're collecting, the lawsuits. So it'll eventually all come out like it has with all the previous drugs, that it creates, long-term problems. But in the short run, that's one strategy. Another strategy would be to adopt a whole plant food SOS-free diet. You'll still lose the weight. The difference is that you can sustain that indefinitely and live a long and healthy life, and then eventually have a good death where you go to bed one night and don't wake up, rather than spending 20 years debilitated post-stroke.
Yeah, thank you. There's a question on gout, tophi buildup, and can the crystals be dissolved? Laura Beth said her uric acid was 9 and they put her on allopurinol. She's
Yeah.
vegan, but not entirely whole food SOS free.
Yeah, so what we do with gout, gout's one of those diseases of dietary excess, disease of kings, and has to do with how your kidneys process uric acid. There's some genetic vulnerabilities, there's some developmental issues. But there's some basic things you have to do. One is adequate hydration, getting enough water and dilute things down. There's some nutritional medicine things that can be done with acidification of the urine, et cetera, with nutritional supplements. There are medications that are used to get the kidneys to push out more uric acid, and to deal with the pain that can be, very severe for gout attacks. Anytime people go through rapid weight loss, they're potentially vulnerable to a gout attack, and that can include fasting or dietary change. But these gout can be managed. Usually, that what we see with gout symptoms is relatively easily managed by hydration manipulation and some nutritional medicine. Occasionally, we'll have to use medication short term. And then once the excess weight loss is off and you're just looking at weight stability, you become much less vulnerable to gout over the long run. So it is a difficult condition. Some people are more vulnerable than others, but it is managed. But it's nice to have a doctor that's experienced with that, not just give you the allopurinol and say that's the end of it, but actually actively work with you in resolving the situation, getting rid of the need for the medication. And that's generally our experience, is people can normalize the situation and get off the need for medication.
Does fasting help with gout?
It helps and it hurts. It can precipitate gout because, again, anytime you do rapid weight loss, which fasting is one form of rapid weight loss, you put increased load on the kidneys. So in some people, if they're too vulnerable, we might actually do it a little slower with more of a modified fasting approach, or just do a straight dietary approach to address their weight loss. But for the vast majority of people, we're able to do fasting. Occasionally, we do have to modify the fast so that it would deal with the overload that sometimes occurs in the kidneys as they process all this excess uric acid.
When you say modify the fast, do you mean like maybe a juice fast or a broth fast?
Yeah, we may go into broths or vegetable juices or other materials, just again, slow down the rate with which the body's mobilizing all this material.
The wonderful things that happen during fasting, like I think you talk about autophagy and things, can those happen with a broth or juice fast or only with?
Yeah, I think they do happen. But remember, most of the research on that, AJ, is actually on modified fasting. Because most of the people out there are not doing what we're doing, which is long-term water-only fasting. They're doing, brief interventions and juices and Prolon and different kinds of substances. So clearly those mechanisms kick in. We believe that it's going to turn out that they turn on more efficiently with water-only fasting, but that research still needs to be done.
Thank you. Mel would like to know, does lipedema require liposuction, or can a whole food plant-based SOS-free diet help resolve it?
Well, I don't think lipedema is resolved with liposuction. I don't think that's an effective. This is an inflammatory condition involving inflammation of the fat tissue. It does respond to fasting and dietary change. I don't think it's suggested that liposuction is a treatment for that.
Thanks. Is that the thing where they wear those tight things on their legs or their arms?
Well, that may be, lipedema in general is inflammation of the fatty material. So it's, we treat it like an autoimmune type, response.
Great, thank you.
There's also problems where people have lymphedema, which I think is what you're thinking of, AJ, where they collect fluid material and they'll use pressure stockings to help with that. We also see improvement with diet and lifestyle change with lymphedema. So there's lipedema and there's lymphedema, neither of which I would suggest liposuction is a reasonable intervention for.
Thank you. CN says, can fasting cure or heal PCOS?
Yeah, polycystic ovarian syndrome is one of the hormone-mediated conditions that occur in women that responds dramatically well to fasting, diet, and lifestyle change. I have a theory, and that's that in women, the estradiol, the active estrogen hormone, is supposed to convert to something called estriol and get excreted by the urine. And that conversion process happens with the bacteria that live in your gut and in your liver. And so I think what happens is that process isn't happening for whatever reason. They got the wrong microbiome because they're eating meat instead of plant-based foods, or eating sugar and processed foods, or taking antibiotics or hormones or whatever. And so the estradiol builds up, and high estradiol is associated with, all those conditions: fibrocystic breast disease, PCOS, growing fibroids, et cetera. So I think the fasting helps in a couple ways. It clears the liver out, so it does its job, and it normalizes the gut microbiome in the intestinal tract, which helps with the breakdown of the estradiol to estriol. And so the estradiol levels drop, and then a lot of those symptoms seem to go away after fasting. And it's interesting, it's not always the first cycle post-fasting, it's sometimes the second one, because the hormones for the first cycle have already been set up when you get into the fast. So there's a little lag, a 30-day or more lag before you see the clinical effect of it.
Thank you. Here's a question from a live viewer named Cece. Let's see, where did it go? Is a hump behind neck and shoulders likely diet related, lots of excess weight? Is it from lots of excess weight or a spine issue? And how do you recommend reversing it?
So the Dowager's hump is largely a genetically mediated predisposition that's aggravated by environmental or epigenetic variables. So, you might be able to affect the function and discomfort and whatnot with exercise. We use foam roller and cervical plank exercises and manipulation and physical therapy and fasting. And so people will feel a lot better, but the basic tendency towards the spine to go a certain way probably is wired in there. You're just aggravating it with posture and body use stuff. So just more important to do the proper posture and body use for people that have that predisposing variable. But I don't know that you can completely reverse it.
Great. Do you have time for one more question? I want to respect your time. I mean, we can go.
Sure.
Okay. This one was sent in earlier in the month, a similar one from Dr. Lisle, but this is, so I know how he would answer it, just in case you say ask Dr. Lisle, but I'm curious because they did send it in for you and it was a different person named Jane. And she says, there was an excerpt from eatingdisorders.org about orthorexia. I started eating a whole food vegan diet after troublesome digestive issues. I've never felt better and I'm at a healthy weight. But according to the definition of orthorexia in this article, with the exception of a decrease in variety of foods and refusing to eat foods prepared by others, I need to seek professional help for orthorexia. Am I missing something or is this just crazy? So here's the question. When does wanting to be pure and eating healthfully turn into a disorder? Yeah, are there certain red flags? How do you feel in general about orthorexia? Does a
Okay,
person,
so orthorexia is basically overly concerned about your diet. And it's true that people can become obsessive and compulsive about anything, washing their hands, locking the doors, and clearly, food could be a potential target of a disordered mind. But basically now, anybody that's concerned about their health or their diet, like, if they happen to be sensitive to, say, gluten or they want to be on a vegan diet, those people have all been broadly diagnosed as having orthorexia. The only thing that's missing is a drug to treat it. And I'm sure that's not far behind. So I think essentially this is mostly nonsense. Now, can people become overly concerned? Yes. And one of the ways you can help manage that is by getting people educated so they really understand how it works and what the priorities and the targets are. And so it's not that it can't become a limiting factor, but essentially if you have an OCD tendency, it can be redirected in all kinds of different ways. This might be a way that it's being redirected, but that doesn't mean that being concerned about your health isn't necessarily an important decision. Whether you need behavioral cognitive therapy to make it work better in your life is another issue. So what did the expert actually say when you addressed this to him,
oh
AJ?
my God. Well, I mean, it was nuanced, his answer, but he didn't believe that the individual submitting the question had it,
Right.
Yeah. Well,
Yeah,
Dr.
because he would
Goldhamer,
probably be more aggressive than I would, because it's his colleagues that are coming up with this ridiculous nonsense where they're trying to um, uh, medicalize conscientiousness.
the problem is when people do go for inpatient eating disorder treatment, they do consider even veganism a disorder because of the limiting of food groups. Because as you know,
Right.
Dr.
And it's
Goldhamer,
just nonsense, because what they'll do is they'll tell people you have to learn to eat normally, but they're forgetting that common eating today is not normal.
but
It's a drug-like effect.
but
And
they say
so,
all foods are healthy in moderation.
yeah. But they don't manage alcoholism that way. They don't say, well, we'll give you some organic beer and some organic wine. They tell them the truth. You need to stop it. But that would be extreme and radical. And so, they wouldn't be very successful in managing a drug addiction. And frankly, they're not very successful in managing eating disorders either.
Okay. Well, two more questions popped up. If you want them, fine. We can also talk to you next month, whatever you
Oh,
prefer.
that's fine.
Okay. So have you ever cared for a patient with pituitary adenoma?
Yes.
Wow. And good outcome or?
Well, some outcomes have been good. We've seen reduction in mass post-fasting, which is interesting, but we haven't published any studies yet. We have seen some pre-post improvements and functional improvements. So don't know exactly how responsive they are.
Great. And can people, Arlene wants to know, with osteoporosis or osteopenia fast?
Yes, they can, but again, like all people, if you have osteoporosis or osteopenia, we want to start thinking about why is this happening? One common reason is low vitamin D. So if you don't have enough vitamin D, you're vulnerable to osteoporosis. We want to fix that. We want to make sure we check your 25-dehydroxyvitamin D storage, make sure it's adequate, and make sure you're getting the sunshine exposure. Number two, we want to make sure your diet is adequate before and after fasting, that's high in mineral-rich foods like fruits and vegetables, and particularly vegetable materials. We want to make sure your hormonal balance is okay, that there's not some issues there. And that may be corrected by fasting, can be very helpful. Another is weight-bearing exercise. If people are not getting enough weight-bearing exercise, they can become vulnerable to osteoporosis. Or if you like are an astronaut and go into space and get into weightlessness, you'll develop osteoporosis. You have to do resistance training. So we don't want to just say, well, we just fast and that's the only tool. There's a lot of things you have to do to try to address osteoporosis. And so as long as all of those issues are addressed, then I would be fine. There's nothing about fasting per se that would necessarily be a contraindication.
Great, thank you. Okay, last question. And I do want to say, if anybody wants to spend
And before I forget, AJ, one of the things we did in that DEXA scanner studies, we looked at bone density, and there was no reduction in measurable bone density in these fasts. So that was not a problem.
Perfect. And before we get to the last question, if anybody wants to spend 8 glorious days at the #1 spa in the world with Dr. Goldhamer and myself, it's called Rancho La Puerta. We're going in July. Just please see the information in the show notes, and you can contact somebody named Donna, and she'll get you either booked or on the waiting list. Okay.
And bring your basketball shoes.
Yeah, absolutely. Okay. Well, 2 more questions real quick. What's the ideal vitamin D level for women? Kathy wants to know.
Which level?
Vitamin D.
Okay, so there's some controversy about what optimum vitamin D levels. We know what's too low. So if it's below that, it requires supplementation or increased sun exposure. We know what's too high, where that can become pathological as a fat storage vitamin. But there's some debate about what's optimum level. People that get sun exposure oftentimes will maintain in that 30 and 40 range. Some supplemented patients will go around 70 or higher. So my concern is just that we don't be too low, that we should be at least in the 30s or 40s, whether it's supplemented or unsupplemented. If it's below 20, I definitely think correction active needs to take place.
Thanks. Okay, for real, the last question. Do you think an all potato or an all rice diet for a period of time could also be good to reset the body and lose weight?
Well, you will definitely lose weight, if you eat a whole plant food diet, even if that's a mono-type diet. I don't know, I haven't seen any actual research saying that would work better than, say, including your vegetable materials and other stuff. So, if somebody wants to do that, I don't think there's a big problem per se short term, but I don't know that it's necessarily ideal. I'm mostly interested in people actually learning to eat a variety of whole plant food diets so that they can sustain that indefinitely. There's lots of tricks people use. I don't have a fundamental problem with that particular one, but I don't know that it works better than just getting people to eat a good, healthy diet every single day.
Thank you. Yeah, I just don't see what I understand like limited variety, but I never understood the benefits for, excluding vegetables. Right?
I agree.
Thanks, Dr. Goldhamer. This was great. We look forward to seeing you again next month for your regular show.
All right. See you then, AJ.
Thanks, everyone. And thanks, everybody, for watching another episode of Chef AJ and Friends. Please come back Friday at 9 a.m. Pacific time for Dr. Ron Weiss, who will also answer your questions. It's called The